Hey folks, it's Dr. Mike, president of the Medical Exercise Training Institute, and I'm back here to continue on with our Medical Exercise Specialist Career Success Pathway. Now, we're going to talk about the first point in that pathway, which is foundation. Now, regardless of where you are in your career, how many years of experience you have, you must have a strong foundation built on anatomy and pathology, medical exercise management, assessment, the whole 9 yards to really produce positive functional outcomes for your clients, which is what helps you grow a strong practice and develop referral relationships. So we're going to talk about that first point. Now, we're somewhat biased here at the Medical Exercise Training Institute. We started the Medical Exercise Specialist certification back in 1994. Now, we have a competitor out there that actually used our name, and we actually fought them in federal court here in Houston. But I think what it says, when someone actually tries to steal your name, it says that obviously you've done a great job in educating those individuals, and those individuals have gone out there and done a spectacular job. Our MESs have done a superb job developing relationships with medical professionals, building their practices, and most importantly, producing positive outcomes for their clients. But it's all because we give them a sound foundation. So regardless of what organization you take your medical exercise training education from, we feel like our medical exercise specialist certification is the one at the top of the list. It's very comprehensive, it's very detailed, it gives you in-depth learning in anatomy, pathology, exercise management of various conditions, and how most importantly to communicate with medical professionals. But whatever course you take, make sure you get a very sound understanding of clinical anatomy and pathology. This goes beyond basic gross anatomy, where you learn muscles and bones. Now with clinical anatomy, you're learning what goes wrong with the anatomy, what the pathology is with various medical conditions, hypertension, diabetes, total joint replacement, spinal injuries. You've got to understand the anatomy and pathology of those conditions. We also recommend that you take some type of corrective exercise workshop, but take it after you finish the medical exercise specialist training. The reason for that is corrective exercise will have you go out and look at clients and base your exercise program on the idea that you can look at the client and determine their muscular imbalances or postural imbalances. Well, I think the medical exercise specialist gives you a more comprehensive idea, not of the muscular or postural imbalances, but what are the other medical issues that can complicate or contribute to these muscular or postural imbalances. That makes a huge difference, especially when you're dealing with the older population, which is what is really driving this whole medical exercise and medical fitness evolution. Also, we highly recommend that you get out there while you're doing your education, get out there and do observation hours in a physical therapy or chiropractic clinic. You need to look over the shoulder of that therapist, or chiropractor, or that massage therapist, athletic trainer, and get an idea of what they're thinking, what their management process is, so that when they pass that client on to you, it's a continuum of care, and you really have a good understanding of what they were looking at. But again, that's all based on making sure you have a good, thorough understanding of clinical anatomy and pathology. Now, we also recommend a medical terminology course. You must be able to speak the same jargon, understand the terminology, the abbreviations, the prefixes and the suffixes, and be able to read some medical reports just like medical professionals do. And in our MES course, we give you that understanding. We even actually teach you how to write progress reports, assessment summaries, because folks, it's 2019 right now, but I guarantee you 20 years from now, medical exercise training will be accepted around the world as being part of the medical management process. But along with that, it's going to require much greater documentation and much greater communication on your part as a medical exercise professional in working with medical professionals. And then lastly, a medical exercise training skills workshop. Now, we do offer one after our MES training, but it becomes essential that you're able to now work with clients and you're able to take the skills that you've learned and apply them safely and effectively with managing your clients. This isn't just simply working with the fitness client where you give them a good workout, they get a good sweat, they feel some muscle burn after they're done. Now you've got to use these skills to produce outcomes, which requires a little bit more understanding, a little bit more detail, and it requires a little bit higher level of professionalism. So this is what we recommend in the foundation component. This point along the way is essential because this now sets the stage for everything else that you'll do as a medical exercise professional. And we feel like a lot of times our fitness professionals who are transitioning into medical exercise or transitioning into medical fitness want to circumvent this area and get on to the idea of becoming a specialist. The foundation is essential. And let me ask this. If your physician, physical therapist, or chiropractor didn't complete the foundation courses in their curriculum and they just went directly to the clinic and then just went directly out and started working with patients, wouldn't you be a little bit leery about them? Or they made up what courses they took because there were certain courses they just didn't like. Realize now that this foundation is essential. These components are all essential in helping you bring all the pieces together to then take that skill and knowledge and apply it in managing the medical exercise training client. So this is just the first step along the way. And our second step, application, we'll talk about in just a second. But please understand, you must have a very, very strong foundation. If you want to get more information on our medical exercise specialist course, please go to www.medicalexercisespecialist.com to get more information. But this whole idea of medical exercise training, folks, is going to get bigger and bigger over the next 20 years. You must have a strong foundation. So we're going to move on to our next component, which is application. So if you have any questions for me, email me at drmike@postrehab.com. Thanks for listening.